Are you a psychiatric prescriber who is hesitant about prescribing lithium? Or maybe you're a telehealth psychiatry provider worried about the monitoring and the blood tests involved. What if I told you that with the right knowledge, you can safely prescribe and monitor lithium even remotely? Hi everyone, I'm Dr. Georgette Kui, a psychiatry provider, and today we are diving into why lithium is a game changer for bipolar disorder. By the end of today's video, you're going to have everything you need to confidently prescribe lithium and monitor it remotely and also manage the side effects effectively. So here's what we are going to look at in today's video. We are going to look at how lithium works, why it is called disease modifying and neuroprotective. We are going to look at dosage recommendations and how to adjust the dosage based on the labs. We are going to look at monitoring lithium levels, the target range, the labs to check, the frequency, and also managing side effects and educating patients effectively on staying safe. We are also going to look at a few clinical pros for psychiatric providers. Please remember, this video is for educational purposes only. The information provided here is not intended to replace medical advice or clinical judgment. Always consult with a licensed healthcare provider before making any changes to treatment plans or prescribing medications. So let's start with why lithium is so important. Lithium is more than just a mood stabilizer. It is disease modifying, meaning that it can actually change the course of bipolar disorder over time. It also reduces the frequency and severity of the mood episodes, helping patients achieve long-term stability and preventing relapse. This isn't just about managing symptoms. It is about altering the trajectory of the illness. Another critical benefit is that lithium is neuroprotective. Studies show that lithium can preserve brain structure, preventing brain shrinkage that often accompanies long-term mood disorders like bipolar disorder. So not only is lithium stabilizing mood, it is actually helping the brain to safeguard the brain over long term. So let's talk about prescribing lithium. So the starting dose for most adults, we typically start at 300 milligrams twice a day. That is 600 milligrams a day. Depending on your patient's blood levels and how they tolerate it, you gradually adjust the dose. The goal is to maintain a serum level between 0.6 to 1.2 milliequivalents per liter. Most patients will end up on a maintenance dose between 600 to 1200 milligrams a day divided into 2 to 3 doses. So start with a low dose to minimize side effects like tremors, gastrointestinal upset, and gradually increase the dose based on the patient's lab results. Now, monitoring is key. Lithium has a very narrow therapeutic window. The range between an effective dose and a toxic dose is small. 0.6 to 1.2 is very narrow. So here's why monitoring is very important. You want the serum lithium level to stay between 0.6 to 1.2 milliequivalent per liter for optimal effectiveness. When you first start lithium, check serum lithium levels every 5 to 7 days to ensure that they are within the target range. After the patient is stable, check serum lithium levels every 3 to 6 months. Please remember that lithium can affect renal kidney function, thyroid function, so it is critical to regularly monitor their creatinine, their blood urea nitrogen, and also TSH/T4 levels to ensure that there are no complications. So if you're a telehealth provider, please don't worry. You can still monitor lithium remotely. So here's how you can manage it effectively. You can partner with local labs. Have your patients go to their local lab to get their serum lithium levels, renal function, and thyroid function checked. Then they can send the results to you via a secure patient portal or fax them to you. And also, there are many telehealth platforms that have patient portals where patients can actually upload the lab results directly to you. You can then review them during virtual follow-ups. And there are also home testing options. Some services offer home blood draws or testing kits for remote patients. This is great if your patients live in a rural area or have limited access to labs. You can now schedule virtual check-ins every 2 to 3 weeks when starting lithium, especially to catch any early side effects and ensure that they are staying within the therapeutic range. So Next, let's talk about side effects and signs of lithium toxicity. This is where patient education is very important. Common side effects of lithium, we have weight gain, tremors, increased thirst and urination, which is polydipsia and polyuria, gastrointestinal upset like nausea, diarrhea. These are usually temporary and can be managed by adjusting the dose or adding supportive treatments. For example, tremors can often be improved by lowering the dose or using a beta blocker. Gastrointestinal upset, it can be reduced by educating patients to take lithium with food. Now let's talk about lithium toxicity. This is serious. This is a serious risk if lithium levels exceed 1.5 milliequivalent per liter. So watch for these signs of lithium toxicity like nausea and vomiting, especially the vomiting, severe tremors, confusion, delirium, drowsiness, blurred vision, muscle weakness, uncoordinated movements. If you suspect toxicity, stop the medication immediately. Check their serum lithium levels and get them immediate help. In some cases, in severe cases, hospitalization may be required. So here are 5 clinical pearls for psychiatric providers. Number 1, hydration is important. Encourage your patients to stay well hydrated to avoid dehydration, which can increase the risk of lithium toxicity. You also need to monitor kidney function, thyroid function. Always monitor kidney function like their creatinine, BUN, thyroid function like TSH, T4 regularly, especially with long-term lithium use. And dosage adjustment, be aware that switching between brands or formulations of lithium may require adjusting the dose to account for the differences in absorption. And educate your patients about the importance of consistent lab work, staying hydrated, and knowing the signs and symptoms of lithium toxicity. Be extra cautious with elderly patients as they are more sensitive to side effects and toxicity. They might need more frequent monitoring, and they might also need lower doses of the medication. If you're a healthcare provider and you're tired of spending hours charting, documenting, or scrambling to find answers to clinical questions, please listen to this. Companion Medical Scribe AI. It is not just a note writer. It is your intelligent clinical partner. It can generate detailed, accurate clinical notes in seconds, in about 15 seconds, and it does so much more, like answering clinical questions in real time with verifiable references, suggesting diagnosis, medications, ICD-10 codes, billing codes. It can create patient instruction material, and it gives you access to specialty-specific templates or lets you build your own. It works across multiple clinical settings, and the best, it is HIPAA compliant. If you're already using another scribe, AI scribe, and you're wondering whether it's time to upgrade your workflow, start a free trial and see the difference for yourself. And if you're a psychiatric mental health nurse practitioner who is preparing for maybe the ANCC or the AMP certification exam, please check out Georgette's PMHMP certification review courses. It is not just another review course. It is high-yield, comprehensive, power-packed program built to help you understand, not memorize, so that you can walk into the ANCC or the AMP exam with confidence. Whether you need structure, clarity, or deeper understanding of the content, this review will meet you where you are and take you where you need to be. So let's go back to the recap for today's video on lithium. So the starting dose of lithium is 300 milligrams twice a day, then adjust based on lab results. Maintenance dose is 600 to 1200 milligrams a day divided into 2 to 3 doses. The target lithium range is 0.6 to 1.2, and monitoring is every 5 to 7 days initially, then every 3 to 6 months once the patient is stable. And you need to monitor the kidney function test and also the thyroid function. And if you're doing telehealth, use local labs, patient portals, home testing for remote monitoring, and also monitor for side effects and signs of lithium toxicity like nausea, tremors, confusion, and also ensure that the levels don't exceed 1.5 milliequivalent per liter. Again, my name is Dr. Georgette Kui. Please follow me for more evidence-based information. You can follow me on YouTube, Facebook, TikTok, LinkedIn. Thank you so much.